the benchmark to provide 85% of children with treatment. Balentla Mthethwa, SABC News, Johannesburg.
Young African girls continue to bear the brunt of the HIV and AIDS scourge. The Centre for the AIDS Programme of Research in South Africa, CAPRISA, says that thousands are infected every day. It says that other vulnerable groups include homosexuals and drug users.
40 years after it was discovered, AIDS still wreaks havoc in many communities. 4,000 people are infected daily. 25% of them are young African women. The world has about 38 million people living with HIV, with 70% in Africa. Health scientists say a new paradigm shift is needed urgently.
And we've got to move to a whole new strategy of a provider-initiated service, where PrEP becomes the norm for communities at high risk. Just think back initially in PMTCT, how low uptake we had for HIV testing in pregnant women, until we shifted it from a provider-initiated testing approach to a user-initiated testing approach to a provider-initiated, where it became the norm. That when you walked in and you were pregnant, you were going to get an HIV test and you were going to get PMTCT medication if necessary. We have to shift our thinking about PrEP along those lines.
Australian authorities want HIV preventive measures to be scaled up. They say after implementing this response a few years ago in their country, there was a sharp decline in new HIV infections by at least 70% amongst homosexual men.
In the setting of affordable PrEP that is now being rolled out in Australia with associated healthcare services, Australia has witnessed very low HIV incidence of 1 to 2 per 1,000 person years amongst gay and bisexual men who were previously at high risk.
And activists say the COVID-19 pandemic has also compromised HIV testing due to stricter lockdown regulations.
COVID came and took all the attention from the HIV fight, from the other fights that we already have in the country. So what we have seen happening, it's when we saw people dying of COVID, but also those who are living with HIV felt neglected.
Attention for HIV is declining. In this global survey, the #1 challenge that people around the world were seeing in 2020 was the coronavirus. It eclipsed unemployment, poverty, political corruption, all of those. So COVID-19 has taken center stage. HIV has been shifted to being in the sidebar.
Half of South Africa's 7.7 million people living with HIV are on treatment. The United Nations says 90% of people living with HIV must know their status by 2030. Vusi Khumalo, SABC News, Durban.